Metal-clad cable is not suitable for use in patient care areas of a dentist office. According to the National Electrical Code, flexible metal conduit, also known as MC cable, is not permitted in patient care areas of healthcare facilities because it can become a source of bacteria and infection. Instead, the NEC requires the use of smooth surface raceways or cables that are specifically approved for use in patient care areas. These types of raceways and cables are designed to be easy to clean and disinfect, reducing the risk of infection. The rationale behind this regulation lies in the stringent hygiene requirements of healthcare environments. Patient care areas, such as those found in dentist offices, demand meticulous cleanliness to minimize the spread of pathogens. Materials used in these spaces must be easily sanitized and resistant to harboring microorganisms. MC cable, with its corrugated surface, presents challenges in achieving thorough disinfection. The ridges and crevices in the cable's armor can trap dirt, debris, and potentially infectious agents, making it difficult to maintain a sterile environment. In contrast, smooth surface raceways and specialized cables offer a seamless, non-porous surface that can be readily cleaned and disinfected. These materials are designed to withstand frequent cleaning with harsh chemicals without degradation, ensuring long-term hygiene and safety. The NEC mandate for smooth surface alternatives reflects a proactive approach to infection control in healthcare settings. By specifying materials that are easy to clean and disinfect, the code helps to minimize the risk of healthcare-associated infections, protecting patients and healthcare workers alike. It is crucial for electrical contractors and facility managers to adhere to these requirements when designing and installing electrical systems in patient care areas. Failure to comply with the NEC regulations can not only compromise patient safety but also result in code violations and potential legal liabilities. When selecting materials for electrical installations in dentist offices and other healthcare facilities, it is essential to prioritize smooth surface raceways and cables specifically approved for patient care areas. These materials offer a superior level of hygiene and safety, ensuring compliance with the NEC and promoting a healthy environment for patients and staff. In addition to the surface characteristics of electrical materials, it is also important to consider their chemical resistance and durability. Healthcare environments often involve the use of disinfectants and cleaning agents that can be corrosive to certain materials. Therefore, it is crucial to select raceways and cables that are compatible with these chemicals and can withstand frequent cleaning without degradation. Furthermore, the installation of electrical systems in patient care areas should be performed by qualified and experienced professionals who are familiar with NEC requirements and best practices for infection control. Proper installation techniques can help to minimize the risk of contamination and ensure the long-term performance and safety of the electrical system. It is also advisable to conduct regular inspections and maintenance of electrical systems in patient care areas to identify and address any potential issues, such as damaged raceways or cables, that could compromise hygiene or safety. By implementing a comprehensive approach to electrical safety and infection control, healthcare facilities can create a safe and healthy environment for patients, staff, and visitors. In summary, the NEC prohibition of MC cable in patient care areas of dentist offices and other healthcare facilities is a critical measure to protect against the risk of infection. By requiring the use of smooth surface raceways and specialized cables, the code promotes hygiene and safety in these sensitive environments. It is essential for electrical contractors, facility managers, and healthcare professionals to understand and adhere to these requirements to ensure compliance and minimize the risk of healthcare-associated infections. Electrical codes such as the NEC are essential to ensuring electrical safety and proper installation in a variety of settings. In a dentist's office, safety of patients and staff is the top priority. Therefore, all equipment and installations must adhere to the highest standards to prevent any potential hazards. Electrical installations are no different, and they have their own specific requirements. Metal-clad cable, while suitable for many applications, is not suitable for patient care areas in a dentist's office. Firstly, the NEC prohibits the use of metal-clad cable in patient care areas of healthcare facilities. Secondly, patient care areas require materials that are easy to clean and disinfect due to the risk of infection. Thirdly, the outer jacket of metal-clad cable can be difficult to properly sanitize because it may have grooves or other surface imperfections. Fourthly, approved smooth surface raceways or cables should be used instead of metal-clad cable in these locations. Fifthly, these alternatives are designed for easy cleaning and disinfection to reduce the spread of bacteria. Sixthly, improper use of metal-clad cable in patient care areas may lead to code violations, fines, and potential safety hazards. Seventhly, consult with a qualified electrician or electrical inspector to ensure compliance with the NEC and local regulations. Eighthly, regular inspections and maintenance of electrical systems are crucial to prevent any electrical hazards. Ninthly, it is important to consider the specific needs and requirements of each patient care area when designing the electrical system. Tenthly, prioritize patient and staff safety by following the NEC guidelines for electrical installations in healthcare facilities. By adhering to the NEC and utilizing approved materials, electrical systems can be safely installed in patient care areas without creating hazards. In dental environments, the use of appropriate electrical materials and installation practices is crucial for maintaining a safe and sterile environment. Metal-clad cable, while commonly used in various electrical applications, is generally not suitable for direct use in patient care areas of a dentist's office due to several factors. Firstly, infection control is of paramount importance. Patient care areas and dental offices require surfaces and materials that can be easily cleaned and disinfected to prevent the spread of infections. The outer sheath of metal-clad cable, with its corrugated or ridged surface, can be challenging to thoroughly clean and disinfect. These imperfections can harbor bacteria, viruses, and other microorganisms, posing a risk to patients and staff. Secondly, regulatory compliance is mandatory. The National Electrical Code, which sets standards for safe electrical installations, typically restricts the use of metal-clad cable in patient care areas of healthcare facilities. These restrictions are in place to minimize the risk of infection and ensure a hygienic environment. Compliance with the NEC is essential to avoid violations, fines, and potential legal liabilities. Thirdly, alternative materials offer better hygiene. Instead of metal-clad cable, smooth surface raceways or cables specifically designed for healthcare environments should be used. These materials have non-porous surfaces that are easy to clean and disinfect, reducing the risk of microbial growth. Examples of suitable alternatives include rigid metal conduit, electrical metallic tubing, or cables with smooth, cleanable jackets. Fourthly, proper installation is essential. Even with the right materials, proper installation is critical for maintaining a safe and sterile environment. Electrical installation should be performed by qualified electricians who are familiar with the NEC and best practices for infection control in healthcare settings. Proper sealing of conduit and cable penetrations can prevent the entry of dust, moisture, and pests, further reducing the risk of contamination. Fifthly, maintenance and inspections are necessary. Regular maintenance and inspections of electrical systems are essential for identifying and addressing any potential issues that could compromise hygiene or safety. Damaged or deteriorated cables, conduits, or connectors should be promptly repaired or replaced. Regular cleaning of electrical surfaces can also help prevent the buildup of dirt and contaminants. Sixthly, specific requirements may vary. It's important to note that specific requirements for electrical installations in dental offices may vary depending on local codes and regulations. Always consult with local authorities and qualified electrical inspectors to ensure compliance with all applicable requirements. Seventhly, consider specialized cables. Some manufacturers offer specialized cables that are specifically designed for use in healthcare environments. These cables may have antimicrobial properties or other features that enhance their suitability for patient care areas. When selecting cables, be sure to choose products that are approved for use in healthcare settings and meet all applicable standards. Eighthly, avoid sharp bends and protrusions. When installing cables and conduits, avoid sharp bends and protrusions that could create areas where dirt and debris can accumulate. Use smooth, rounded fittings and connectors to minimize the risk of contamination. Ensure that all cables and conduits are properly supported and secured to prevent sagging or movement. Nightly, educate staff on safety. Educate dental staff on the importance of electrical safety and hygiene. Train them on how to properly clean and disinfect electrical surfaces and equipment. Encourage them to report any potential hazards or concerns to the appropriate personnel. 10thly, document and track maintenance. Maintain detailed records of all electrical installations, inspections, and maintenance activities. This documentation can be helpful for demonstrating compliance with regulations and tracking the performance of electrical systems over time. In conclusion, while metal-clad cable may be suitable for some electrical applications in a dentist's office, it is generally not appropriate for direct use in patient care areas. Instead, smooth surface raceways or cables specifically designed for healthcare environments should be used to minimize the risk of infection and ensure compliance with the NEC and other applicable regulations. Proper installation, maintenance, and staff education are also essential for maintaining a safe and sterile dental environment.